news can reveal that the NHS in England has bought hundreds of thousands of oxygen monitors for patients with coronavirus to use at home. Doctors believe it will save lives. It follows research suggesting that even a small reduction in oxygen levels can be a warning sign of a dangerous deterioration with COVID-19. The devices are being given to patients aged 65 and over and others in high-risk groups in a new rollout. Our health correspondent Sophie Hutchinson reports.
It could have ended completely differently, so, I suppose I do owe them my life, really.
Dorset, where they've taken the fight against the coronavirus into people's
NHS,
homes.
what
Lessons
a
learned from the
joke!
Have highlighted the danger of leaving some
About
to sit out the infection alone.
10 months late, they clock out the obvious. I bought this, well I ordered it in mid-March and arrived in early April.
The bit of kit is a small, relatively cheap device known as an oximeter, which measures
because of the coronavirus, you need one of these.
Patients like Michael Kerr, who are aged 65 and over, or who
January 2021, now the NHS buys oximeters. They should have bought these at the beginning.
Some patients with the virus are not breathless, despite
this is how
oxygen levels. This dangerous
apart from masks, one of the first things I bought was one of these and a UV lamp to kill the virus.
The pandemic has shown that even relatively small drops in oxygen levels
what
can
a
be
joke! No wonder there's 100,000 dead.
Illness. A reading of 95% and above is considered normal. At 93 and 94%, patients are now told
You've got basically an incompetent government and NHS.
2% or below, people are asked to recheck it, and if it's the same,
We've been recommending get these since March.
I'm alright, I'll be okay, I can get on.
Hospital is where
Another item you can get is a UV lamp, but you don't really need it now. And everyone gets masks now.
She would never have known.
We've been using masks since early March.
If it hadn't have been for the monitoring service,
97.
I don't think it would have been picked
so
up.
the way you use this, if you suspect you've got COVID, monitor your oxygen levels.
So grateful for having that service, and if
we're so grateful for having this crap service.
It could have ended completely
10 months late they give you. Every home should have one of these.
And doctors behind the scheme
because
say small tweaks to patient
you can monitor the oxygen levels for any drop. Should be above 94. 94 should be minimum. Anything below that is a warning sign.
A simple intervention like an oximeter.
Yeah, you're late.
Because by getting to patients earlier, we can prevent their severe
you are useless.
and potentially their future
January 2021 now. It's big news.
And because of the impact of COVID-19 on the lungs, doctors believe everyone should now have an oximeter at home. These small devices.
January 2021, everyone should have one at home. They should have said this in March.
A new study suggests coronavirus infection rates in the community in England.
The government is useless, the NHS is incompetent. Don't clap for the NHS. 100,000 dead. Racist institution. Double Asian and black community deaths.
So much
these are an oximeter is a must, which I've been.
Is Emeritus Professor of Statistics at the Open.
Shut up. Shut up. An oximeter is a must. It's something I've been saying since March. They only cost about £30 for a decent one. Don't get the cheapest one that costs £15. They're probably not going to be accurate. Pay around £30 to get a decent one. Although now, given today's news on January the 21st, 2021, now they say go and buy one. Where were you in March, you useless pieces of waste of space? NHS is a waste of space. The government is a waste of space. Why are they saying it now in January 2021 to get something that was obvious to, well, someone who's got a brain? in March that you needed one, and I bought one. Ordered it in mid-March, got it around the 8th of April, something like that, 6th of April. And basically used it whenever feeling like you might have COVID, like a cough. Just monitor your oxygen level. You know, like for someone in this is my age, I'm in my 50s, get 96, 97. Child will be 100, you know. If most young people will be 100. It goes down slightly with age, but you know, over 94, like they say, contact GP. 93. Once it goes to 94 or less, like what they're saying now, but you're too late. What are you mental? January 21, nearly not a year, was it 10 months into the pandemic now, you say? It's going to be big news all day today on BBC 6 o'clock news to get one of these. Okay, what else should you get apart from this? Like I say, well, everybody knows about masks now. What else would I recommend? UV lamps. Lots of decent N95 masks, not those cloth crap. You know, get something. I've got some here. Yeah, something like these. Pack of these N95 masks that you can get rid of. There's a N99 masks as well, with the valves in. Yeah, there's these, the next level up. And I've got, oh yeah, this is the N90, the 3M masks. These are, well, they were hard to get. So just have a stock of masks. You can use them more than once, but as soon as they start to smell or get clogged up, throw them and use a new one. They're not expensive now. In March when I first got them, they were very expensive. Like these were about £4 or £5 each. Now you can get what, less than £1 each now. Same with these. These are more expensive. They're 3M ones. So use decent masks, not those cloth ones that do nothing. Obviously they stop people from spreading droplets, but they're not going to help protect you much. That's why the pandemic's still raging, because people are using crap masks that are probably only 30% effective, whereas these are supposed to be 95% effective, but I'd say they're more like 90%. This one's supposed to be 99%, probably 98 actually. These are, what are these? Which ones? These are the same as them. No, these are slightly better. Yeah, they've got the valves in. Make it easier to breathe and better quality. There's the mask. So that's the second thing I recommend. Then there's the UV lamp. I've got some here. They're not really used, but basically it's all precautions. I know in terms of health, well, vitamin C and decent strength vitamin D. You know, this is flu season as well. So that protect against flu, and a decent vitamin D strength, 4,000 IU. I remember when I posted a video in early March, YouTube deleted it because I was recommending vitamin D to protect against the virus, and 4 or 5 months later it became, the medical establishment started iterating the same. This goes to show the medical establishment is an ass. You know, they were same with the masks. Remember at the beginning they were saying don't use masks, and the reason they were saying that is because they didn't have any stock for the doctors and hospitals to use, so they want people to buy these up. At the time I used a big mask, a big bulky mask. You know, one of those, it was a 95, not one of these, it was like a DIY mask that I already had. That was a 95. Is a good one. And it was, in fact, it was better than these 95s, because obviously it was cost about £40 several years ago. And I used that until these arrived in April. It took 5 weeks for these masks to arrive, 'cause they came straight from China. So I had to use the mask I had before the pandemic. Anyway, the latest news just iterates that the medical establishment, the NHS, the government, they are incompetent. If they were competent, the number of dead would be less than 1,000, not approaching 100,000. So that's my best tip, apart from obviously the Oximeter that I ordered mid-March and got it early April. It's useful in case you're not feeling well and you suspect it might be coronavirus. You know, see, back in April and March they weren't doing anything. People were just dying. They weren't even recommending anything. At least now they got some treatment. Oh, it's okay. I'm old, but you'll... Plus these aren't going to be 100% accurate. 95, 94 is okay. When it goes below 94 consistently, that you gotta, is there some caution, note of caution. 94, it depends on your age. That's another thing that they don't tell you on the news. It's age dependent as well. The young, readings will be 100%. The older you are, the lower reading. I think there's going to be a lot of people with readings at, you know, in the 70s who have 93, and they're going to be calling the doctors now with these. Oh, my oxygen's fallen. But for them it might be normal. Depends on age. You know, lung function decreases with age. So there you have it, NHS. We all clap for it, but they're useless.